Hello, it's Jeremy from the First Aid Team. This week's topic is burns. Now, we've all probably done it. Bit of sunburn, had an argument with a cup of tea, and we know that they can be painful. The problem is we don't tend to take burns seriously enough. We don't cool them long enough. We don't get treatment when we need it. There has been a massive increase in the older population in skin cancers, melanomas in particular. And when the researchers looked into this, and this was published about 2-3 years ago, they were able to link it back to the increase in package holidays back in the 1960s and 70s, when perhaps we weren't as aware of the importance of sunscreens and covering up when it's a bit sunny. Net result, a lot of people are reaping the consequences. Now, there are 7 categories of burn. We have wet burns, your hot liquids, dry burns, flame and so forth, electrical, chemical, friction. If you've ever had an argument with a bit of AstroTurf, you'll know what a nasty burn that can give. Radiation, which is where your sunburns are, and ice. In general, cool it for 20 minutes. This is a change in the teaching. We cool it now for a minimum of 20 minutes. Lots of cold running water over the injury. Once we have the heat and pain out of the burn, then we need to remove any loose clothing and jewellery. Having done that, then a good emergency dressing, a good temporary dressing is a bit of cling film. Lightly applied, not doing your pack lunch up, but lightly applied to keep the injury clean and allow it to swell. Quite clearly, for major burns, you're going to be phoning the ambulance service. For less severe burns, then there's an assessment process, which I'm going to cover in a separate video because I don't want to do too long on this one. It could go on for about 20 minutes, but we'll deal with that in a separate video. One thing I will flag up is if you are dealing with an electric burn, make sure that the power is off before you go anywhere near the patient. You don't want to become a casualty as well. Do consider that if you have had an electric shock, your heart is at risk. The medical profession estimate the heart risk period following an electric shock is anything up to 6 hours after the electric shock. Chemical burns, don't go steaming in with water. Check the packaging, check the label, check the cost data sheets in your workplace because there are some chemicals you should not use water on. Just bear in mind, folks, that only 1/3 of burns occur in the workplace. You're far more likely to have to deal with it at home, at leisure, on the beach. Also think about the fact that 70% of burns occur in the under-4s. Anyway, take care. I'm going to come back to this topic in a separate broadcast next time. But in the meantime, have a great week and I look forward to speaking to you again. Bye-bye.